Acute respiratory distress syndrome is a condition with a significant healthcare burden but limited treatment options. Thus, identifying patients at high risk for ARDS would be important for implementing preventive strategies. My name is Aysun Tekin. I'm a research fellow at the Multidisciplinary Epidemiology and Translational Research in Intensive Care Lab at the Mayo Clinic. I will describe our study today titled Development and Validation of an Acute Respiratory Distress Syndrome Prediction Model in Coronavirus Disease 2019, Updated Lung Injury Prediction Score. We conducted our analysis on the dataset collected within the scope of the Viral Infection and Respiratory Illness Universal Study Registry, which is abbreviated as the VIRUS Registry. And I am sharing our findings on behalf of the Society of Critical Care Medicine Discovery Virus Registry investigators. The registry was partly funded by the Gordon and Betty Moore Foundation and Janssen Research and Development Company. A CTSA grant from the NIH and the Mayo Clinic Critical Care Independent Multidisciplinary Program Research Subcommittee supported this specific project. The Lung Injury Prediction Score is a validated tool for predicting acute lung injury. It was developed in 2011. In this study, we aim to develop and validate an updated lung injury prediction score for COVID-19 patients. To ensure adequate granularity of the data, predictive model development was performed on patients enrolled in the virus registry from participating Mayo Clinic sites, which are Mayo Clinic Rochester, Arizona, Florida, and Mayo Clinic Health System hospitals in Mankato and Eau Claire. We determined the development of ARDS during admission using a modified version of the Berlin definition. Initially, we calculated LIPS for the included patients. Thereafter, we determined the additional variables to include in the model using a backward elimination variable selection method. After developing the model, we tested its performance on an external cohort, including patients enrolled in the virus registry from over 120 institutions and 15 countries. Here in this figure, you can see the graphs of receiver operating characteristic curves for the LIPS and the updated LIPS for classification of ARDS in derivation and validation cohorts. In this large multi-center cohort study, we assessed the performance of the existing previously validated LIPS for predicting COVID-19 related ARDS. Then, using routinely available clinical data variables, we developed an updated score, which we called CLIPS, that incorporated predictors specific to the COVID-19 population. The CLIPS offered better discriminatory performance than the LIPS alone. The CLIPS still has a modest positive predictive value, which may limit its routine clinical use. Thus, future research is needed to test and improve the model's performance with potential additional variables that were unavailable in our study. Nevertheless, through the identification of COVID-19 patients who are at greater risk of developing ARDS, the CLIPS has the potential to improve the practicality of ARDS prevention trials and expedite the enrollment of patients. Utilizing our predictive model could help identify patients who can benefit from interventions that prevent disease.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.